Hi, Dr. Gullberg here, continuing our infectious disease series. Today we're talking about HIV infection. It's a two-part series. So HIV is a lentivirus. It's a retrovirus, otherwise known as HTLV3. First described in 1981. Attaches itself primarily to the CD4 cell, the lymphocyte, which is really the conductor of the symphony, of the immune system in the body, killing the CD4 cell. Spread by blood primarily and is also an STI. There's 5 basic clinical stages. Number 1 is the seroconversion illness, which is at 2 to 6 weeks after inoculation. Number 2 is the asymptomatic stage for up to 8 years. 3 is a persistent lymphadenopathy stage. 4 is the AIDS-related complex where the CD4 count is greater than 200. Of course, normal is around 500. And then the 5th is the AIDS stage where the CD4 count is less than 200. There's over 20 different opportunistic infections that will occur in this stage. So HIV has sanctuaries in the lymph system where it's very difficult to kill it. We still don't have a vaccine that's super effective. And to my knowledge, there's been no cures. The cell-mediated immune system is significantly affected by this virus. And basically there's 5 types of infections that we see once the HIV virus gets very active in the body and patients develop counts of less than 200 in their CD4 count. Bacterial, fungal, viral, parasitic, and then malignancies, all part of the cell-mediated immune system that goes awry. So the bacterial infections we see are MAI, MTB, recurrent bacterial pneumonia is very common. Fungal infections include candidiasis, seborrheic dermatitis, cryptococcosis of the central nervous system, other dimorphic fungi in the liver, lung, or disseminated. And then we see also pneumocystis jirovecii, pneumonia, most commonly. And meds for this organism include trimethoprim sulfa, pentamidine, Mepron, dapsone, even clindamycin and trimecturate have been shown to be helpful, along with the use of steroids if the PO2 is under 60. In the ER, look for high LDH levels in these patients as well as a diffuse interstitial infiltrate. The third category, of course, is viral infections. We see a lot of CMV, especially retinitis, colitis, EBV, which can produce lymphoma, oral leukoplakia, and monotype syndromes. Varicella problems such as zoster is an issue, as is recurrent herpes simplex virus can cause esophagitis, that type of thing. Herpes virus 8, which is associated with Kaposi's sarcoma, is also an issue, as is JK virus, which causes progressive multifocal leukoencephalopathy. Fourth area is the parasitic infections, so cryptosporidiosis can be a problem. Toxoplasmosis can cause central nervous system disease and retinopathy. And lastly, the malignant cancers, which can cause especially high risk with cervical cancer, lymphoma, especially in the central nervous system. So be aware of the cell-mediated immune system going awry in patients with HIV. Thanks, Dr. Gullberg, signing off.